Let's talk about GLP-1 receptor agonists and their effect on massage therapy and the massage appointment. This itself could be its own class. So we're just going to um, hit some of the highlights in this video. There's going to be so many resources for you in the printed section of this segment to really do that deep dive. This is the peptide that I have seen most in my practice, both with people with lymphedema diagnosis, people after plastic surgery, people who are coming in for their longevity massage. The GLP-1 receptor agonist is widespread. It can be given from their primary care physician. You can also get GLP-1 receptor agonists from different places in the community. And this is so important for us as massage therapists to know, because we need to realize that we may be the only person that's seeing all their medications in one place on the health history form. There is not necessarily just one doctor that's giving them all their different medications. And this means we have to be very cognizant of things that could happen if they're getting one medication from one doctor and another medication from another doctor, and the left hand doesn't know what the right hand is doing in our client's life. And it all comes down, and the buck stops here at our massage table when we're massaging them. We are responsible to understand what some possible drug-drug interactions are. So let's get into it. The main side effect of the GLP-1 receptor agonist, very famously, is nausea. They can have nausea, they can have digestive upset. This can happen in the day after, especially peaking of symptoms, the day after that they inject, the day they inject, and especially if they go up in injection, if their dose is getting stronger. So this is something, as I mentioned earlier, if we understand that that's what they're on and they intend to increase their dosage, that's a good time to take a few days off from their massage schedule so we don't get a potential of a missed appointment, canceled appointment at the last moment because they feel nauseous, because they have digestive difficulties, because they have diarrhea, and they cannot keep their massage appointment with us. Understand the lack of physician oversight. They may be getting this medication from a med spa. They may be getting it from their plastic surgeon. They may be getting it just online. And this has difficulties because GLP-1 receptor agonists can affect the bioavailability of other medications, the birth control, but also many other medications, because of delayed gastric emptying, because the stomach is not emptying at a normal rate. That's part of the GLP-1 receptor agonist efficacy. So that means that the drugs may not be entering the system as fast as they are supposed to. Um, Also, some of their other medications, if they have chronic illnesses like diabetes, like hypertension, these medications that their actual primary care physician is giving them can many times be weight dependent dosing. So they're giving them a dose of that medication at the weight that they think they are. What if they're getting a GLP-1 agonist medication from someone else? Their weight is decreasing, but they're still on this medication that's given to them when they were at a higher weight. That medication can have a different interaction in the body. Their insulin, their hypertension medication, this can lead to side effects of the low blood pressure, the low blood sugar, because they're not on the medication that is correct for their current weight. And we need to see what are the possible side effects of having a client come in with low blood sugar, with low blood pressure. How do we keep the massage safe for them? Also, in the literature, and you can read all the journal articles in the print section of this segment, there's research on increase in surgical site complications if someone is on a GLP-1 receptor agonist and had surgery. So understand that that may be coming into our massage room if our client has a GLP-1 receptor agonist listed on their health history form. Also, there's possibly good effects on skin fibrosis if someone is taking a GLP-1 receptor agonist. There can be positive effects on lymphedema and the risk of lymphedema. And again, all of this research is listed for you so you can read these articles. And one thing in a drug that's potentially coming onto market soon, one of these receptor agonists called Retatrutide, they have found about 7% in their studies of skin sensitivity. And it may be when they increase the dose, it may be because they're taking the medication itself. If they're on Retatrutide, they may have increased skin sensitivity as a side effect of that medication.